Okay, if you're suffering from shingles like I have, I just thought I'd kind of tell you my story about what I found. I kind of took a shotgun approach to treating this thing, or actually dealing at least mostly with the pain. And I figured I'd just go through everything I used and the effectiveness and hope that it helps somebody else. First of all, the basics were getting diagnosed, and then the treatments. I was first given Valtrex, and these are the antiviral medications, but Valtrex, and then acyclovir to the course of that too. So those are just the antiviral treatments. But I guess the bigger thing, I think, for most of us who have this is dealing with the pain. And so I'll go through the different things that I've used in the effectiveness. They gave me initially some Vicodin. I don't like Vicodin, really. I don't like being out of it. So I just kind of tried that once when I was in most pain, but I don't know if it really made as much of a difference as, say, when I had like shoulder surgery. So anyway, so that I'm just going to stick over here. And then I was also given, initially I had a lot of pain in my back. I was given a muscle relaxant. That was actually fairly effective. And that was called, let's see, it's called cyclobenzaprine. And sorry, I'm kind of intentionally avoiding not showing the labels because it seems like not a good idea to put that out to the world. And then something that's pretty interesting is the gabapentin, which I know it's pretty popular. People have used it. I initially tried that. It didn't work. And then I talked to my doctor, and he told me, he said, well, you could take up to X amount max a dose. I did that once, didn't notice that much of a difference, but then did a second one in the same day, which I was allowed to do, no problem. And gosh, it took a little while, but within, I'd say, a couple hours, I was pretty much toast. I was jello. So it worked in the sense that it totally relaxed me, and the pain went away, but I was tossed. You would not want to be operating heavy machinery or driving or trying to work, because you're basically got to be ready just to be laid down and watching TV or sleeping or something. So that works, but for me I needed higher doses, and so I'm going to talk now about the stuff I tried to use basically during the day or at night when I got up, just as a topical treatment. So first off is obviously, I don't have it out here, but ibuprofen. It didn't really do much for me. I don't know why, but I guess maybe I didn't give it as much of a shot. I typically use acetaminophen, and this is just a generic Walgreens acetaminophen, and that was pretty good. So I'll put that right there. It's pretty good. Surprisingly good, but not complete. The other thing I noticed is when I wasn't sleeping at night, and I knew I had to get up and go to work, and I woke up with a headache, I actually took some Excedrin. This is, again, generic type of Excedrin, which is basically acetaminophen, aspirin, and caffeine mixed together. So you wake up a little zippy, ready to go, but it actually did a pretty good job with the pain. So those are the things that I used. And then working, if I was distracted, it would be okay. I'd still tighten up, and I mean, I was working abbreviated days, especially during the worst of this. Topically, like at night, initially this crazy aloe, which has some, obviously dyed to be this bright green, worked pretty well, it seemed. And I don't remember exactly the stage of where the rash was, if it was more closed up or not, but it actually worked pretty well. I got this, somebody told me to get pure aloe, and I got this 99% pure aloe vera gel from Trader Joe's, but that just actually stung. So that didn't work real well for me, to be honest. I'm going to put that over here. This crazy, anti or post sunburn type stuff worked the best, and then for some reason it started to burn. So that's kind of a middle of the road thing that worked. doctors and other people I talked to recommended capsaicin. I think that's how you pronounce it, or capsaicin. And I tried it, but it burned a lot and made my skin really red and seemed to just add one level of discomfort in exchange for another. So I did not continue to use it. In general, I tend to be kind of sensitive to some stuff, or if there's like a low percentage of somebody having a problem, that's me for some reason. So I don't know. I mean, I hate to just disregard it completely because it might really work well for you, and but for me, it wasn't that great. So I'm going to stick it over here with the aloe. That worked for a while and then didn't. I read about some other stuff, basically using Vicks VapoRub. Here's kind of another generic for that. And that actually worked pretty well. The problem is, I'm sleeping in the bed with my wife. I felt horrible for her. Like, first of all, I wake her up going in pain to put something on, and secondly, I reek of this stuff. But it does work. Ideally, if I was hanging out, like out by the TV, I could just have my shirt off and have that on. It was fairly comfortable. At night, I'd put on a shirt, and I think it would absorb it and kind of reduce the effectiveness somewhat. But that's pretty good. In fact, for generic stuff, that's pretty safe and inexpensive. It's pretty good. Okay, along those lines, I saw somebody else on YouTube who said something about Jason cooling gel, and I could not find that. I went to every health food store around us. I could not find that stuff. Some places like Whole Foods near me used to carry it, but doesn't. So I tried to find kind of an alternative, and I found this stuff called mineral ice. This stuff reminds me of like green slime. It's like very gelatinish. It's like green slime. It looks like something a kid would play with. See that? But it reeks. This stuff smells like toxic, and it's disgusting. It's weird. I put it on in less sensitive areas where it was just more underlying nerve pain, and it seemed okay. Then later on, after maybe 45 minutes, it really started burning, and I took it off, and the skin was red underneath. I do not like this stuff. I will not be using this again because it hurt. So anyway, put that over here. I also got this all-natural baby chest rub. Again, this is along the same lines of looking at the methylatum stuff, although this doesn't have it. Active ingredients in this are more like, natural ingredients, sunflower oil. I don't know if you can see that. Coconut oil. See if this will focus. Sorry. I'll just read it. Sunflower oil, coconut oil, Candelia wax, castor oil, shea butter, vitamin E, chamomile, dillweed, lavender, eucalyptus, patchouli, and coriander. This stuff smells really weird and really didn't do a whole lot. But maybe it would for you. And it didn't hurt me. So I'll leave that out. Okay. I was thinking along the lines of arthritis and joint pain stuff. This really didn't work. This is also something I got at a health food store. It's kind of natural. It didn't really do much. I'll just put that way over here. It didn't offend me, but just didn't do well. This anti-itch cream, surprisingly effective. It's got hydrocortisone. I don't think you'd want to put it on an open wound, but it was actually pretty good, especially for the itching, obviously. Anyway, so most effective thing, bottom line, topically for pain, was the VapoRub type stuff. And here's the generic one. Itching, the anti-itch cream. And for pain, it would be the acetaminophen and the Excedrin. And the gabapentin works if you can handle being completely out of it and don't mind that. All right, hope this helps somebody. Good luck.